everyone. It's Jo here. So we just wanted to give you the opportunity to have a soft launch of one of your next assignments. Now, this is for 316, which is Principles of Small Animal Veterinary Nursing and Critical Care, which we will be studying together from September. Now, I appreciate you've just finished your exam. An assignment is probably the last thing that you want to think about, let alone do anything towards. But hopefully you'll see from the assignment brief that this is something that's worth thinking about. Now, as I said, this is a soft launch, so the assignment is not due until well into the autumn term, but it does require you to collect case studies in a fairly similar manner as you would have done for 315. So hopefully you'll see by the end of this lecture the type of patients you want to start collecting and the kind of information that you're going to require. So let's look at the assignment first. So if we just looked at it from a basic blurb requirement, what you're required to do is to explore the dynamics of nursing support for sick animals. And as we said, it's through a portfolio of case studies. And we're going to talk through the kind of cases that we're expecting you to see. Now, one of the critical things for this assignment is it has to be patients that you have had an active and extensive role in their care. So it can't just be an animal that, let's say, a really interesting case came in and you observed for 5 minutes out the back and then you went off and did something else. It has to be something that you yourself have had a role in their care. Now, that might be that you did... you saw it when it immediately came in, when you triaged it and you stabilised it. It might be that you had it hand over from another nurse and it was your role to monitor that patient. It might be that you did some first aid and then later on you were participating in surgery. Whatever it is, there has to be something that you have actively participated in. Probably one of the best ways to check this is for you to pick a patient that you feel comfortable talking about their nursing care. And often that's quite a good sign, isn't it? That if there's a case where we have actively been involved in its care, it tends to be the ones that we feel quite comfortable talking about the care that was received, the animal's condition, maybe some of the follow-up care that you've seen with that animal. So do spend a little bit of time selecting your cases. Because to be quite honest with you, the more time you spend at this stage, the better it will be. So don't panic, don't start kind of like we do in the sales, kind of panic buying and looking at all the different cases. Do spend some time, as I say, over the summer, selecting your patients, choosing which ones you're going to do. So in terms of what we expect you to have as part of your case report, so very similar to 315, we're looking at 3 patients. So the first one is an emergency patient. So obviously, as we know, there are a whole variety of emergencies that we can see in practice. It might be a purely medical emergency. So for example, you might have a blocked bladder cat. It might be an ingestion. So maybe you've had a chocolate toxicity or a rat poison toxicity. It could be an RTA, but that might be one of the other ones you want to do in a minute. It could be, for example, a basic wound. It could be a dystocia, it could be a C-section. There's a huge variety of things that you could have. Equally, you might want to think about doing something like a GDV, or you might want to do something like a splenic torsion, something like that. Now, I would say at this very beginning, I do appreciate that we all work in slightly different practices. And for some of you, you will be really, really spoilt in the range of patients that you're seeing. And I do understand that for some of you, you're in practices that maybe you don't do your own out of hours, maybe you transfer to an emergency vet, and initially you feel like it's quite limited in what you're going to see. But I can assure you, you will have something that's suitable, even if it's something like, we're entering into hopefully quite a nice hot season. It could be something like heat stroke, it could be a panic attack, potentially you might have a brachycephalic breed that's had tracheal collapse. As I say, it could be a blocked cat, it could be a diabetic crisis. There's all sorts of different things it could be, so don't necessarily panic too much that you're not seeing a really exciting emergency case. As I say, there's lots of range of things that you could have. The next one we've got then is trauma. So tend to think of this more of your RTAs, your degloving injuries. It might be a fracture repair. It might be a dislocation. It could be a really nasty wound. You might, for example, have a dog fight. So we had a case fairly recently of a dog that had a quite extensive avulsion on its back, so that would be quite a nice trauma case. Again, huge amount of choice, but with our trauma cases we want to think about something that we are triaging and stabilizing fairly quickly. Now that might require surgery, but again, think of it from a point of view of how are you managing the immediate concerns surrounding hemorrhage and first aid, and then how are we stabilising the patient. And then the third one is intensive care. So again, this opens up a huge variety of patients you might see. It might be that you've got a ongoing patient who becomes a terminal patient. It again might be an ingestion or a poisoning. It could be something like a permethrin poisoning. So where like we had one recently of a kitten that had experienced permethrin poisoning because its owner had not realised how toxic it was, how potent it was, and she'd given the kitten some permethrin, Bob Martin flea products, and then she sprayed the house. So that kitten for a short term would also require intensive care, but obviously I do appreciate that it would also be an emergency. So this is why it's important to spend some time over the summer, hence why we're launching the assignment, just to kind of look at some different cases. And what I encourage you to do is to think about different cases that you've seen, simply make a note of those patients that you've seen, and then it gives you some variety and some time to play around with them, depending on which ones you think are suitable. The other thing that's really important is they need to cover a range of species. So that, as per 315, it includes a dog, a cat, and an exotic. So again, have a think about your patients. It might be, for example, that you have you're more likely to get for example, a trauma cat, because without being horrible, it's more common that cats are involved in RTAs than maybe a rabbit or a bird. But equally, you might find that something like myxomatosis is an emergency situation. Your intensive care patients, it might be that you've got even something like a rabbit with gut stasis could be considered intensive care. So as I say, if you are struggling, do please contact me. But the really important thing is just to spend as much time as you can over the next few weeks looking through the cases that you're seeing regularly in practice. I'm quite happy for you to have done anything from Easter onwards. So as long as it's within a shorter window, that'll be fine. But it might also be that you've already got patients that you've used from your MPL that you want to transfer across to this assignment. So let's have a look at the learning outcomes that you're being assessed. And what I would say from the very beginning is you are expected to cover all the learning outcomes, but you are not expected to cover every single learning outcome in every single patient. So similar to 315, there is a case of marrying up the learning outcomes to the patients. And again, the more you look at the learning outcomes, it might start stirring some ideas of the type of patient that you're considering. So 2.1, sorry. So the first thing we want to think about is the concept of triage and identify situations that constitute emergencies. So within this, you want to talk about, firstly, what is triage? Again, hopefully you are triaging quite frequently at work. It might not be a really severe emergency. It could just be something along the lines of, I've got a dog who's got quite severe diarrhea, what should I do? So again, if you are sat here thinking, oh, I just don't see emergency cases, I can assure you do, but it might be that you're not necessarily seeing the kind of blood dripping, bone exposed kind of ER type situation that maybe other people do. But as I say, we triage things all the time. So it's a case of thinking about how you triage, why is it important, why do we even do it? You know, what's the purpose of triage? And then also think about the communication approach to it. So, you know, actually, how do you triage? Like, do you do it methodically? Do you have a process? Is it that the nurses go out first and get key information before the vets go out? So that's 2.1. 2.2, we want to think about how we prepare for the admission of the patient. So again, depending on your patients that you're seeing, it might be that we're placing our animals straight into a contained oxygen tent, and that's what we're doing for as part of their admission. It might be that, say we've got a GDV, we need to put them on straight onto fluids as they come out. So part of your process to admit that patient is things like getting catheters ready. Think of your C-sections that come in, what things do you get ready before they come in, what kit do you prepare, what medicines do you want to have available to you, right down to things like, are they going straight into kennels, are they going straight into surgery, are you going to stabilize them in the prep room before you do anything. So we'll keep coming back to these learning outcomes, and hopefully, as I say, well, not hopefully, we will come back to this, but hopefully as we start the module in a little bit more detail, again, these are things that will come a bit clearer. But as I just wanted you to think about it before the summer started. So learning outcome 3.1, we're thinking about intravenous cannulation. So firstly, thinking about the principles of it. So what are the indications? Why do we give fluid? And again, depending on the emergency that you're referring to, if you've got a trauma, it might be that we've got quite significant blood loss. Our patient has a fluid deficit, for example, something like a GDV. It might be that our patient has gone into shock and actually we're treating the signs of shock. It might be that our patient, if we've got a heat stroke patient, it might be that our patient is experiencing hypothermia and actually the fluids are a way of cooling that animal down. But also kind of flip it the other way. If we've got a hypothermic patient, it might be that we're giving them fluids as a way of warming them up. So again, there's lots of different indications that we are talking about, and I would assume for most of our emergency patients or our critical patients, we're putting them generally onto fluid therapy, if not immediately, but fairly soon within their patient care and their admittance. So again, hopefully there's lots of different things you can touch on. Think about your access points in your veins. So again, depending on your patient, it might be which of the veins are most visible. If we've got a highly shocky patient, it might be that we're not able to place an IV in the cephalic vein, so maybe we choose for the top of their femoral vein. It might be for us, our small furry, that we just can't access venous access at all, so we think about doing intraperitoneal fluids instead. So again, these are just things that you can discuss. Also think about the selection of the cannula. So hopefully there is some level of thought when you pick your cannula. But for example, are you going to use, what size cannula are you going to use? Hopefully you're always going for a slightly, the biggest cannula you can place. But again, it might be that your patient is hypovolemic and you can't access their veins very well, so you have to go for a smaller one. It might be as a practice that you're using butterfly cannulas. So again, it's just things like this that you want to think about. Any risks and complications. So we've talked a little bit about poor blood supply or hypovolemia, but potentially we might have the risk that our patient is very painful and they're quite hypersensitive. So actually any placement of anything is going to cause some concern. Maybe we've got an animal who's very nervous and quite scared, so actually placing a catheter is going to be tricksy. So again, these are just things to think about. So learning outcome 4.1, thinking about the accommodation required. So again, this is huge. This is quite an extensive area, and again, you might find that hopefully for your critical care patients particularly, that these are things that you're being mindful of, but equally with your trauma patient, it might be that your vet's asked you to, you've put a bandage on and your vet's asked you to observe for any further signs of hemorrhage. So thinking about the type environment, are they potentially infectious? Is there a high risk of infection to them? So are we requiring reverse barrier nursing, for example? Thinking about the environment, so again, think about all your different stimuli. Do we want to have, lots of we want to take away all the stimuli. So do we want the lights turned down? Do we want the sound turned off? If we've got an emergency seizuring patient, it might be that actually the environment itself is really, really important. So we want to make sure that they're well padded, that there's not other species around that are making lots of noise. With our exotics, are we thinking about them as a prey species? Is there any, are there any possible species that might be a concern to them? Obviously, with critical, it's important that we're observing our patients, that we are allowing them to have easy access to oxygen, proximity to electrical supply. So in our picture here, we've got a number of syringe drivers. Again, it's not ideal if we're putting our patient on fluids and then the battery runs out. And then also thinking about observation charts as well. So we'll come back to this and we'll do this in a bit more detail. But again, it's just things to think about. Think about the nursing needs of the critical patient, and obviously that's going to be quite a big area, but it might include things like their breathing, their cardiovascular function, their nutrition, their fluid balance. So what we said, we're going to put them on intravenous fluids, but actually how are we supplying that, how are we monitoring that, are they able to move around, what concerns might that present? So, you know, have we got a dog with a fractured leg that now can't stand to urinate? Is there a risk of decubitus ulcers? Is there a risk of hemostatic pneumonia? Are we going to have to turn them? Are we going to have to support them to make them comfortable? General hygiene. Again, we tend to think of our, you know, with our trauma patients, potentially we might find that they're bleeding, particularly if they've stressed, or if something's happened and it's been traumatic. Maybe they've got urine and feces around them, those kind of things. Body temperature is obviously really important. Pain and stress, equally really important. So these are the kind of things that you want to pull out of your care plan. 4.3, so we want to think about record keeping and reporting. As I say, we'll come on to that itself. Learning outcome 5.1, so explain the observations required. So this is all about monitoring. So thinking about the frequency of monitoring, what we're actually monitoring. So is it just vital signs? Are we doing blood pressure? Are we doing neurological, ECG? What are we using to monitor our patients? So, you know, you might be really lucky and have a really snazzy multi-parameter. I have to be honest, I love a multi-parameter for ECG, but equally if it's kind of beeping at me and I can't get the wires connected, then often it can be a bit of a distraction. So again, just thinking about, you know, how often are we monitoring? What are we doing with it? You know, your basic monitoring would be things like your stethoscope and, you know, your eyes and your ears, and that's great. So thinking about how often you're observing based on your patient's condition. And then the last learning outcome that we want to think about is species-specific nursing. So obviously we've already said we want to think about cats, dogs and exotics. And again, there's an area here that you want to focus it in. So, you know, for our trauma patient, what are our specific nursing requirements? If we've had a GTV and our dog's gone through to surgery, you know, what are the surgical procedures in place? If we've got a guinea pig with bloat, for example, what medical conditions are we focusing on? So, as I say, we'll come back to these learning outcomes. But as I say, the key thing is that all learning outcomes are required to be addressed within the assignment, but not every case study. So one of the things that I would encourage you to do over the summer is, as you're starting to collect cases that you think might be suitable, just to try and map them. So, you know, let's say you've got a list and you just write down all the patient care. Okay, which of them are going to cover your learning outcomes? And that's really, really important before you start writing your assignment, because there's nothing worse than starting an assignment, picking your cases and then realising that they just don't hit the learning outcomes. Similar to 315, we are going to be quite strict on this. So do make sure that you take the time over the summer to look at your case studies, and do obviously get in contact. So if you are struggling to find cases, or you're having a bit of a wobble, you're not really sure which ones you should do, first obviously start kind of mapping them out. But if you are getting stuck, of course, let me know, get in contact. So in terms of the specifics of the assignment, because obviously it's all well and good me telling you need to get case studies, but it's quite helpful to know what you're going to do with it. So first thing, this is quite a big assignment. So the maximum word per count we're looking for is 3,500 words. Now that obviously feels quite a lot, but it does show you, or just shows how much kind of detail needs to go into this. So you guys are going into year 3, and the expectations have changed ever so slightly, that you're reflecting and you're discussing your care in lots more detail. So again, it might be worth, if you've still got it, you haven't had a ceremonial bonfire, that you go back and have a look at your 315 assignments, and just see, you know, where was the feedback. So, you know, maybe you've been told that you need to evaluate a bit more. Maybe you've been told that you need to be a bit more descriptive. So I would really encourage you to go back through those and have a look. But as I say, word count is 3,500 words, but the appendices are not included in it. So we do need you to be collecting supporting evidence, which is another reason why I'm keen for you to have this before the start of the summer. So supporting evidence is anything that demonstrates the care of your patient. So it might be existing hospitalisation forms, it might be lab forms, it might be anaesthetic monitoring records, it might be pain scoring systems, it might be x-rays, it might be a triage form. Hopefully if you triage your patient, you've written some stuff down, so it might be a triage form, it might be your consent form, it could be any telephone communication you've had with the owner at the very beginning. So all of these things would constitute your supporting evidence, and these are the kind of things that would then go into your appendices. So the other things that's required, you do need to write care plans. Now, I can already hear the groan from you guys before I've even seen you. But it's a really helpful way that we can assess your ability to nurse your patients. So with your care plans, as per 315, it's entirely up to you which care plan model you use. I personally quite like the ability model, just because I find it is, although it is still a care plan, I know people don't like them. I personally love care plans. I find them really, really helpful. But the ability model is obviously a veterinary specific, so that's quite helpful. But again, think of it a little bit strategically. So if you know that you naturally don't really analyse or look at a patient as fully as you could do, then it might be worth thinking of using a model that maybe is a bit more extensive. So obviously Roper, Logan and Tierney is probably our most extensive care plan with our activities of living. So again, think about that. But the key thing with your care plans is it has to show that you've included the nursing profile. So you've planned, you've implemented, you've evaluated your nursing care plan. If I could pick up my highlighter now, I would be circling evaluation, because that's really, really key in this assignment, and we'll come back to why. So you need to be able to provide patient information, obviously really important. And as per 315, the patients have to be real. So what I need you to do, again, this is something else to make sure you've got a handle of, is to collect your patient ID. Now, I don't want any other personal information. We obviously are in the age of GDPR, so I don't want you to be putting clients' names or addresses or anything like that on there. All of that is sensitive information. But what I do need you to be able to do is to give me an ID number. Now, hopefully your system at work gives you an ID number, but if it doesn't, you can obviously create these yourself. But it needs to be traceable. So if the RCVS or City and Guilds come to us later and say, oh, on the 1st of September, Kieran showed this particular patient, we need to be able to go to Kieran's practice and recognise the patient that's there. Third thing you need to do is think about the veterinary diagnosis and then the treatment. And then the more kind of important areas for this particular assignment are the nursing needs and the nursing treatments. So as I say, it's care plan based, so hopefully that's giving you some hints already of what we're looking for, but there does need to be an evaluation of the nursing care. So you've recognised what your patient specifically needs and you've responded accordingly, and maybe your patient hasn't responded as you hope, so what intervention are you putting in place to allow them to do that? So a nice simple example, let's say we've got a dislocated hip in a collie, and initially on admit she's put on buprenorphine, and then when you check to do a pain score, 4-6 hours later you find that she's really painful, so the vet prescribes methadone. That could be something that you want to comment on. But equally, if you've got a dislocated hip, thinking about how the patient is actually being able to get comfortable, how can they settle themselves, what stimuli is there around that might be soothing them or encouraging them. On the reverse, what could be stressing them out. How are they nil by mouth? Do they need fluids? What other medications might they need? Have you got an open wound, a closed wound? All these different things. So there's huge amount of stuff to discuss. And then within that, you've then got your discussion. So your discussion is going to take up the biggest part of your assignment. And in your discussion, you're going to be reflecting on the care that's received. So one of the things that I will put up for you next week, again, you can kind of ignore it if you want to, but I will put you up some PowerPoints around reflective models, just as a little reminder, a little bit of a revision. Again, I would really strongly encourage you to use some reflective models for this assignment. So whether you want to use the Gibbs cycle, which I know some of you did for 315, or whether you want to use something like you've got the Atkins model, Atkins and Murphy, which is about what you've learnt. There's quite linear models. There's all sorts of different things you can use, but I would encourage you to use a reflective model, particularly for this assignment, because there is such a heavy emphasis on reflection and discussion and self-reflection as well. It's really, really critical. Key thing to remember is you have to use references. So we're still using references and we're still using the Harvard system. So again, something to do over the summer is to start collecting your references, would be really helpful. And as I said before, your supporting evidence as well. Okay, so as I say, this is designed to just be a soft launch. Appreciate you've just done your exam, but I was quite happy, not quite happy, I was quite keen for you guys to have as much warning as possible about this assignment, so you've got time over the summer to collect your information. One of the things that I'm going to upload as well, which you might be able to see under this PowerPoint, is a discussion forum, because I'm quite keen for you to be able to have lots of time to process this and ask questions as you need to. Now, one of the key things, just to remind you, is that the summer is obviously fast approaching us. Not to panic you, you've got me for another month, but I will be going on annual leave from the 20th of July, and I'm not officially back until the 17th of August. So that gives us about a month of a window where I probably will check my emails, but it won't be as instant as normal. So I would really encourage you guys to spend the next month mulling this over, looking at the assignment brief, starting to think about patients that you might want to use. Any questions you've got, chuck them in the discussion forum, the assignment forum on Ledge. If you've got any worries or anything specific, feel free, of course, to email me. I should put my email address on here, but it's jo.bond@sparshot.ac.uk. And just keep in contact. Obviously, you could ignore it till September, but I would strongly advise against that, just to make sure that you have got the time to start collecting your cases.